So this is a typical vertebra, and this is how the spinal cord is present inside the spinal canal. Okay, such a small area, right? So any compression can significantly injure the spinal cord. So, and moreover, it has its own fascicles, the roots and the artery and venous supply. So it looks something like this. Okay. So what is this gray distribution, and what is this light gray, and what are all these things? Let us try to name the parts. Okay. So one is the central canal. What you see is a central canal, and 2 is a posterior medial sulcus, and 3 and 4 are the gray and white matter. Okay. So this is going to be the dorsal root ganglions, and this is again the ventral root ganglion. The 7th, these things, the finger-like projections, or the fascicles, and what you see here is the anterior spinal artery. Okay, very, very important. Note it down. We'll see the importance of this anterior spinal artery when we are discussing about anterior cord syndrome. Okay, so the 9th one is arachnoid matter, and 10th is the dura mater. Okay, this is the structure which is present into this small area. Okay, so now if you go into that, when you slice the spinal cord at a level, so this is what you will see. Okay, so what I need to understand, to make you understand, is 2 points. Point number 1, the spinal cord has something called as efferent fibers and afferent fibers. What are efferent and afferent fibers? That coming from the brain to the muscles to the efferent organs are called as the efferent fibers. That is from up to down. When there are fibers which is coming from the muscles or tendons from the body to the brain is called as afferent fibers. Okay, so these are the efferent fibers and these are the afferent fibers. So you need to know what are the efferent fibers and what are the afferent fibers. So efferent fibers are the pyramidal tract and extrapyramidal tract. Okay, easy. So now my question is, why these are called as pyramidal tracts on the first place? How does that name come, pyramidal tract? Okay, the answer is, when they come across the medulla oblongata, they actually form the pyramid of medulla. So those fibers which come from the brain to the periphery, to the body, through the pyramid of the medulla is called as pyramidal tract. Those fibers which is not coming through the pyramids are called as extrapyramidal tract. Okay, easy. So where exactly is it pyramids? Can you see that? So you'll be able to appreciate a green structure, right? So that is the pyramids of medulla. So those fibers which is crossing through the pyramids, they actually decussate at that level. So these fibers which is crossing through the pyramids of medulla is called as pyramidal tract. Which is not crossing through the pyramids is called as extrapyramidal tract. Okay, little posterior to the pyramid, what you see here, there's another structure that is called as tegmentum. That is where the extrapyramidal tract goes. Okay, so these are pyramidal tract, that is extrapyramidal tract. This is pyramid, behind that is going to be tegmentum. Okay, so coming again. So pyramidal tract and extrapyramidal tract. So what are the functions of pyramidal tract? Voluntary functions, right? For example, you need to take a cup, you need to drink coffee. So all these things are voluntary function. This is by your pyramidal tracts. The brain thinks and gives impulses to the peripheries, and you are able to initiate and do the movements. This is called for the pyramidal tracts. What does extrapyramidal tract do? These take care of the reflexes. Okay, when you're doing something, you touch a heated object, suddenly you take off, right? So all these reflexes is done by your extrapyramidal tract. Not only that, it also has significant influence on your voluntary reflexes as well. For example, you need to do a voluntary movement. It has to be smooth. The initiation, activation, the coordination has to be very smooth, right? Whenever you are trying to do a purposeful movement, the agonist and antagonist muscles to equally cooperate, right? One has to relax and one has to contract. So that smooth coordination is also done by your extrapyramidal tract. Okay, so these are your efferent fibers, and there are some afferent fibers as such.